Good afternoon, everyone.
Please go ahead.
I will be presenting on the correlation between clinical features and the histopathological characteristics of a primary pterygia. Pterygium is defined as a growth of fibrovascular tissue from bulbar conjunctiva onto the cornea. Extension of the pterygium over the cornea and its fleshiness vary widely among individual to individual. Correlation between histopathology and clinical features is not addressed widely and is important for understanding the pathogenesis. The present study, it was designed to evaluate the correlation between the same. This is a prospective interventional study from April 2023 to November 2024 in about 100 eyes with primary pterygia. All the patients with pterygium undergoing surgery for decreased visual acuity or cosmetic reasons were included in the study, whereas pseudopterygiums or coexisting conjunctival diseases and patients on prolonged topical medication for pterygium were excluded from my study. Complete comprehensive ocular examination was done, including slit lamp biomicroscopy, photography, and dimensions on the cornea were measured. The length was taken as the distance between the two opposite edges of the pterygium intersecting at the limbus, whereas the width was taken from the edge of the pterygium apex to the plica. Plica semiluranus present or obliterated was assessed. Redness and fleshiness were graded from grade 1 to grade 3, both. The excised pterygium samples were sent for histopathological analysis and were analyzed by a pathologist. The characteristics that were included vascular density, vessel count in high power fields, vessel count, subepithelial and stromal fibrosis, stromal elastosis, and leukocytic infiltration. The study included 100 eyes with a mean age of 51. Mean dimensions, the length was 5.45 and width was 11.3. Redness in the pterygium was graded as grade 1 in 32% of the eyes, grade 2 in 33%, grade 3 in 35%, and fleshiness T1 in 34%, T2 in 36%, and T3 in 30%. Coming to the results, as there was a positive correlation between the increasing length and width with the grade of the redness and fleshiness of the pterygium. There was also, with the increasing grade, there was more redness and more fleshiness seen. Also on histological correlation, there was vascular density, stromal fibrosis, and leukocytic infiltration and stromal elastosis, which were found to be significant. This is a picture which shows diffuse redness with on histopathology showed increased vascular density and fleshiness, which demonstrated stromal fibrosis. Positive association between lesion dimension, redness, fleshiness, and vascular density was also reported by Redda et al. Our study showed stromal elastosis in about 50% of the cases, which could be related to various environmental factors. Stromal vascularity and fibrosis show significant clinicopathological correlation. Stromal vascularity is an important and a promising therapeutic target, especially in patients who come for cosmetic complaints. This could be a valid reason for use of anti-VEGFs as a target therapy for pterygium, reduction in vascularity, and decrease the progression of the pterygium. Studies have shown positive histochemical staining of VEGF in the wall of the blood vessels in all the studied lesions. This study correlates many histopathological variables answerable for the difference in the nature of the pterygium. It can help plan new therapeutic agents to reduce vascularity and fibrocollagenous multiplication. Pre-treatment classification based on size, texture, vascularity of the pterygium may provide a prediction for postoperative recurrence rate. Thank you.
So you people took the grades, different grades, grade
Yes.
1, 2, 3.
Yes, sir.
And then the histopathology.
Yes, sir.
So it is quite obvious. More severe,
More.
severe.
Yes, sir.
So therefore, what is the new findings that you think this study tells?
So-
or did you do immunohistochemistry on these?
No, sir. So there's very few studies which actually show the correlation between the histopathology and clinical features. So we just wanted to know if there was a chance where we could, because what our findings showed was there's a lot of vascular density in all the pterygium samples that were sent. So if we do use VEGF as anti-VEGF as an adjuvant to surgery, it might also reduce the recurrence rate of the given pterygium.
So I think we've already a lot of work has been done with anti-VEGFs and pterygiums. So I mean, what would we have really gained with that? I mean, that's something that I was wondering. Anyway, thank you.
Thank you.